I'm Neeta Somaiah, a sarcoma medical oncologist at MD Anderson in Houston, Texas. And on behalf of my co-authors, I presented data on C131, a phase 1 study of CMB 305 in patients with NY-ESO-1 positive recurrent or metastatic soft tissue sarcoma. CMB 305 is a prime boost approach that targets the NY-ESO-1 antigen. It involves LV 305, which is a dendritic cell targeting lentiviral vector that contains the full-length NY-ESO-1 RNA, and also G305, which is a potent TLR4 agonist that is co-administered with the full-length NY-ESO-1 protein. It's integration deficient and replication incompetent, the lentiviral vector. And this approach, this sequential administration approach, leads to a robust immune response against NY-ESO-1, including both T cells and antibodies. Importantly, this immunotherapeutic approach does not require HLA matching or ex vivo manipulation of patient cells or myeloablative conditioning. Last year, we had presented data on LV 305, which is a component of CMB 305, and at that time, median overall survival for LV 305 had not been reached, with an overall survival rate of 81%. Importantly, there was one patient who had a dramatic reduction in tumor volume, achieving a PR that occurred 1 year after study entry, and this patient still is a long-term responder. So this is consistent with an immune-based mechanism of action that takes time to develop but could persist for a long time. For the C131 CMB 305 phase 1 study, we included a total of 49 patients in the safety population, and this study included a dose escalation and then a dose expansion cohort. There were 25 soft tissue sarcoma patients, majority of whom had synovial sarcoma or myxoid round cell liposarcoma. 92% of these patients had metastatic disease at study entry, and 56 of these patients had disease tumor progression at the time of study entry. These patients, majority of these patients had 2 or more lines of prior chemotherapy. The overall survival for these patients, the median overall survival has not been reached for these 25 sarcoma patients, and the 12-month overall survival rate is 83%. The disease control rate was 64%, and the median progression-free survival was 4.7 months. Though there were no partial responses in the CMB 305 study, we did notice that patients who had tumor progression at the time of study entry achieved a durable tumor growth arrest. And several of these patients had an induction of immune response against NY-ESO-1. So the exploratory biomarker analysis was actually very exciting and intriguing, because we did see 70% of patients who had an induction of immune response against NY-ESO-1, whether it be T cells or antibodies, and around 32% had an integrated immune response, which included both T cells and antibody responses. And when they did a combined analysis we did a combined analysis of LV 305 patients and CMB 305 patients, and what was noted is those patients who had an induction of who had a baseline immunity against NY-ESO-1 and had an induction of immune response on therapy seemed to have a significant overall survival advantage compared to patients who did not have baseline immunity or an induction of immune response. So these immune biomarker analysis will guide future randomized study that we hope will get this immunotherapeutic approach for sarcoma patients with NY-ESO-1 positive tumors.